Think about this for a second. More people in this country die from drug overdoses than in car crashes every year. It's why the president called the U.S. opioid epidemic an emergency earlier this month. But what if a fix could be found in a shot, like the one you get for chickenpox or measles? The U.S. Secretary of Health and Human Services says that it's something that is in the works, but exactly how would it work? 10 News reporter Josh Sidorowicz found out that it might not be the simplest solution for a problem that is only becoming more complicated.
When I was using, I would do whatever it took to get that next high.
Max Coulter became addicted to pain pills by the time he was 14, but pills soon became mixed with alcohol, mixed with even stronger drugs. Cocaine ultimately became his preference before he was even 20.
Just progressed into using every day. You know, I had to wake up and use. It wasn't even to the point of feeling good.
Sinking deeper into it, he watched his ambitions fade as he watched his friends die.
I probably could have overdosed.
Till 2 years ago, he decided he'd had enough and entered treatment.
The amount that I was using, it just seems crazy thinking about it now, like what I was actually doing.
For Max, getting clean meant getting help through support groups, but new research could mean that getting clean someday could be possible with a vaccine.
Basically utilizing our own immune system.
But unlike other vaccines solely designed to prepare the body to attack an invader, Dr. Vicki Buckles with USF explains that this instead would teach the body to react to the drug before it hits your brain, stopping the high.
So when a substance entered the body, our body doesn't react until it reaches the brain. So the idea is that now we would have antibodies that would react as soon as a substance was entered to the body, and it wouldn't need to go to the brain.
Because drug molecules are even smaller than viruses, this vaccine would have to make them bigger. Picture Pac-Man gobbling the drug up before it can have any effect.
And then it's no longer accessible to the brain.
Different drugs would require different strains, and it wouldn't be used preventatively like today's vaccines. While it's a concept that holds promise, it is one Dr. Buckles acknowledges still has major downfalls. Downfalls Max recognizes firsthand.
It's amazing that they've been able to create things like that, but the whole basis of recovery is acknowledging that I had a problem. Going through that recovery program, it changes the thinking. It's not just about the drugs.
Josh Sidorowicz, 10 News.